Good afternoon, everyone, on a Friday. This is Jill Cooper with Lipo, and this is one of our many teleseminars that we are bringing to you this Friday afternoon. I'm going to introduce Dr. Michael Renzulli. All of you guys know Dr. Michael. I work side by side with him most every day, and let me just say I haven't met anyone as dedicated and passionate and who is committed to seeing you guys succeed. I mean, you don't get to see what I do behind the scenes, but let me tell you, he is there every single day in your corner in some fashion. And so, Dr. Michael, without further ado, please take it for a moment.
Thank you, Jill. Appreciate it, everyone. Welcome, everyone. Beautiful Friday. No matter where you are, just know that you're going to be infused with nuggets of gold, as usual. John, are you with us?
Yes, I am.
Hi, everyone. So just to give everyone a background, Dawn comes from a very strong sales background. She was a medical device distributor for a high-level manufacturer in lasers, both invasive and non-invasive. And she took that knowledge and that skill and that understanding, and she is not a licensed medical provider. However, she has a rather very, very busy facility in California where she has a 75% closure rate on 75% of all people that she sits in front of. She closes on with Lipo, and she does strictly Lipo. She has 5 of our machines and understands this business and understands the patient psychology, understands people well, and we're blessed to be able to have her on the line. Dawn, can you just give us a quick background in terms of what brought you even into the industry? Just give us a little bit of your background to illuminate, to expand upon what I said, if you would, please.
Well, my background was previously in, like Michael described to you guys, was in laser technology, both invasive and non-invasive. So I was the North Regional Manager for Northwest California, and I did that job for 3 years on the veterinarian side, selling CO2 invasive lasers, and then I took that to a non-invasive, which was for pain management laser, and our distributor was out of Fairport, New York. The corporation was out of Fairport, New York. Distributor was out of Italy. So I then took over the medical division, and there were 5 avenues of target markets that we hit, and that was podiatry, neuro, ortho, chiro, and MDs. So from there, I was how I was introduced to the body contouring light was I was doing a convention in LA, and I saw that there was a product there, and I saw what it did, and once I saw that, I thought there was a lot of value to that, because I see what doctors can make with these type of medical devices. So because I know the ROI on it, and I know what I make, and I'm traveling and killing myself to get back and forth, although I made a very good living, if you could just take that, and it's the only product I know that generates immediate income revenue. It's a profit center. So it's knowing how to, the technology's there, it's knowing how to market it. So with that technology, I teamed up with a doctor. I then started a business in Napa Valley. I took that business from Napa Valley, and then I took it over to Roseville, California. I've been in business for 3 years, and I've done everything under the sun as far as sales. I've done real estate. I've done medical equipment, and this by far is the most profitable business I could ever be in or ever hope for. And I work 3 days a week. I see my clinic. I started out with 1 laser, 1 doctor. I was able to eliminate that doctor and just use him I offer weight management because I really don't need him because, as you guys know, this is a non-invasive procedure, so it doesn't require that you have a doctor. but it's nice to have one to incorporate if they need further assistance in weight loss, because we just deal with inch loss. So I started out with one laser 3 years ago. I now have a facility where I run 5 lasers, 5 rooms going. I see consultation-wise over 100 people a week. Out of 100, I'm probably between the 60 to 70% close ratio, staying consistent for holding 3 years. The numbers never deviate. If anything, they go up. But I'm always have stayed at my quota, if you will. My quota is this: you don't leave the office until you at least you've pulled $5,000 in. So my average is somewhere between 7,500. If you work like I do, I work from 10 to 4, and I only do this 3 days a week. So if you guys do the math on that, you're bringing in $20,000 a week. You times that, you're at $80,000, and you're working part time. My overhead is 30. And that's everything. That's every employee. That's my equipment was paid off in the first month of being open, and it allowed me. Not only was it paid off, it afforded me 3 other. I went that fast. I went from 1 laser and excuse me, in reality, I'm sorry, I would call it 60 days, having to go to 4 lasers and then bringing on the 5th laser. And this is all equipment paid for in month 5. I did gross revenue in the first 3 months of my business at $250,000 in the first 3 months. Which,
that's
by
impressive.
The way, well, yeah, it is until you have to pay taxes on it. Okay, so that's when
Dawn, I just wanted to say something real quick. You had mentioned that you had added your 5th laser. You're specifically meaning the Lipo Light, which is LED, correct?
Correct.
Okay, because some people like to
start out. I just would like to further back my statement. I did not start out with this. This is the new product line that came through another doctor. I did not start out with that product, no.
So let me ask you, Dawn, there's probably a broad range of doctors who are on this line right now, as well as maybe people listening. What would you say? Obviously, there's a broad range in terms of their experience, in terms of their mindset, where their head is at. What would you say, just to begin with, say, a newbie doctor or a newbie practitioner, just in terms of where their head needs to be, where their mindset needs to be? What would you, because I think it all starts with that. What would you recommend? What pearls of wisdom can you give them?
As far as what? The consultation, or where they need to be business mind wrapped around the equipment?
Right. Where they need to start with in terms of having their business head on, in terms of having their mind set, in terms of what their perspective could be, or what with a frame of reference.
First of all, I don't know what kind of doctors we have on the phone with us. So every doctor, if you're in practice, let's say you're a chiro, or even MD, it doesn't really matter, I guess. And how many patients are you seeing a week? And you all know that insurance now is, if you're relying on insurance, the chances that doctors still being in business, unless you have a thriving or 2 or 3 doctors in one office, or, it's a scary place to be, because insurance is not covering what it used to. You're getting paid less, and less. And so to keep your doors open, you're having to see 3 times more people work 3 times harder to make less money. So you better convert your business into some type of a cash business to be able to stay afloat and offset that. So if you have, and I have never seen another product other than the non-invasive pain management laser that can do just that and generate immediate income. When you're selling this and you're staying reasonable in pricing, remember, you're the doctor. They come there to listen to you and what your advice is. So I don't know too many patients that are questioning doctors And if I can do this, and I'm not a doctor, and I'm not getting too many questions, but I'm educated enough to know how to deal with the patients and what their needs are and what they're trying to achieve and what their main objective goal would be. So it's really, every patient is different, everybody's needs are different, and everybody's pricing range is much different. So you need to be very flexible with that. I can tell you this, it doesn't matter if you charge $500 or you charge $1,500. You pay somebody $10 an hour to run it, you're still making a ton of money. Even if out of 100 people, well, let's just use your existing database, which you guys have for patients. Let's say you have, 5,000 or 2,000, and you captured 10%. This is without even marketing it. You guys already have a set-in database where you had a huge advantage over me, which I had nothing. I'm not a doctor. I don't have a database. So if you guys were to take, this is where your leg up is, to advertise this throughout all of your patients, I have no doubt that you couldn't capture a bare minimum of 20% of your existing database.
So let me ask
you. That's without trying to sell it. That's just, sending something out and getting the people through the door. And then, So anyway, go ahead. What's your question, Michael?
Let me ask you, give us if you would, could you just walk us through, say, your consultation, exactly how you frame it, how you go about yourself, and what you attribute to your success?
I just think that the target market is everybody 40 and over, and I meet that criteria. So and everyone, there's two things that are recession-proof, and that's pain and that's vanity. Those are the two things. People will skip their house payment, their car payment, they'll take it out of the kids' college fund because nobody likes to hurt and nobody likes to look old. All right? So those are the two things that will affect one. And esteem is a huge issue, and I think in today's job market, people are trying to look, there's few of them, the best they can be, so competition is stiffer. And then if you're in pain, of course, you can't. I have both pain management and, which I have a doctor behind that, but as far as the Lipo light, I deal with my patients is a lot of times you'll have a patient in front of you, and your job isn't really to ask them what they want. You need to tell them what they need. But you first need
people are looking for direction. They want to be told what to do.
They need to be absolutely. So my theory is this: you need to take control of that patient. You don't let your patient take control of you. You take control of the patient. That's why they're there. They're looking for something or somebody or anything in their life to make a difference, and they are sitting and absorbing. And so you did have to be able to read that because, listen, it's a different song and a different dance for every patient. The formula stays the same of how I present it, but there's some people that are very it's menopausal, they're very sensitive. Others are doing it. Everybody's doing it for a different reason. Very few people are really doing it for themselves. It's it's a health issue. We all know that carrying a certain amount of fat in the mid-waist area is the most dangerous place you can carry weight. So you've got people that are really for health. Not most. 90% it's, hey, I need to look better. I'm on my third marriage. My husband's having it. You hear it all. But everybody's there for something, and they want you to tell them how they're going to change that. And
so if you would, just give me some of your scripting that you would walk a patient through in terms of your consultation.
Well, first you identify what it is. What is it today? You walking in the clinic. What is it that you hope to achieve, and how can I help you achieve that? How can we get you there? You tell me what you want, and I'll tell you how I'll get you there. So if they're saying, well, I'm looking to lose 4 to 5 inches, and I would tell a patient, the only time you ever come in and you do something like this is when you've exhausted every other avenue of trying to get it off. And if you can't get these inches off through diet and exercise, of course you're going to look better. But there's just an area where you're never, ever, and I don't care how much dieting you do or how much exercise you do, there's always going to be that area after a certain age that you can't get to. You're not going to. It is what it is after a certain age because the cells expanded. And so the fat, any little bit of fat that you ever carry, some women have areas, some women have an area. But whatever that is, what this does is eliminates the fat from the cell. It shrinks the cell down so you can evenly distribute your weight if you have some weight fluctuation. And again, anything is only as good as you maintain it, right, through proper diet and exercise. So you take them through a series of 12 treatments. It's a minimum of 2, not exceeding 3 per week. And really you're their biggest cheerleader, their biggest fan. And they're seeing you 2 to 3 times a week. They have somebody really helping them. And then also, too, I tell them, I said, a lot of reasons that people give up on diet and exercise is because you just don't see the result fast enough. So you give up and you walk away. So, I put way too much time into this. I'm starving myself. I'm hitting the gym, and I'm just not getting there fast enough. So you get discouraged. This, you're seeing immediate results. We're all wired the same. Everybody wants instant gratification, and you want it now. Unless you can see it, obtain it, and grab onto it now, a lot of us we're not patient to wait for things that are going to be good in life. Everybody's wired that way. So this is where this comes in. So if within 2 weeks, I can tell you, you're going to see a difference with measurement. Something that if you went 6 months to the gym, you couldn't do. How would you feel about that? And then how would you feel if I could take it even further than that? Because after, from the 6th to the 12th treatment, it really takes off at that point. And it's really at that point, sign me up. It's really not even a conversation past that. Because I said, once you get that 2 or 3 inches, it totally changes the way your brain thinks. You can walk away from that piece of cake now. You can say, hey, I'm going to get out and walk. I'm more motivated now than I've ever been because there's 2 reasons why. One, you're financially invested, right? And 2, you're emotionally invested. Your time's worth something, and if you have to be here 2 or 3 days a week, you're gonna go with the whole program. The no food 2 hours prior, the no carbs 2 hours after. You're going to exercise. So now you've got an emotional and a financial commitment, which even further takes somebody, I think, just takes them over the edge. And that's basically where I take it. And it's just almost a no miss.
Basically what you're saying is you're making a distinction to them. I don't care what else you've tried. This is
I don't care. If there's
technology.
here's what I'll tell them. Here's what I'll tell them. And that's all they need to hear. I just see this fat little belly roll I got here, and this is, 99.9% of anybody, especially heading towards menopause or even before. Just call it a couple kids later and, in your 40s, it is what it is. You're not getting that back. And here's not on your own anyway. So if that's the area, because this is specific and we target one area, and I tell them there's not enough sit-ups in this lifetime, okay, that you're going to be able to do to get those inches and the contouring that you're trying to achieve, forget about it. If you're trying to do it at the gym, if you're trying to do it through a trainer, if you're trying to do it through diet, and here's what differentiates us. Oh, and if you're thinking about traditional lipo, you may want to rethink that. That's why they've come up with new technology, state-of-the-art technology, is that we've eliminated the risk involved with what's involved with invasive. And there's 2 things of why it's not such a good idea anymore, and they've gone an alternative route. One is if they take too much, you got the caving effect. Oh, and by the way, it's invasive. And the other component is if they don't take enough, then you've got the lumpiness, the where the fat comes back undistributed and you'll have lumpiness. Or my all-time favorite, which is half of the clients that I treat, yeah, they look great there, but they've had some weight gain and it came back someplace else. And then also, let's talk about the health risk involved in anything invasive. I say after a certain age, you never elect a surgery if at all possible. You never want to do that if there's an alternative. It just shouldn't be elective. And what I would tell one is that, if you're thinking about, well, I checked out, invasive, well, that's great, but check this out. The risk is never really in any procedure, actually, in the surgery itself. It's in the anesthesia, the difference between waking up or not after a certain age, okay, it's higher risk. And the second one is in post-op infection. And this, you have no downtime. We've eliminated the risk of the anesthesia and any type of infection. And you have no restrictions after leaving the clinic physically. You can get up, go back to work. In fact, the more active you stay, the better results you get. And it's just, there's no downside to it. There's just not.
So we have this, I don't know if you've seen that New York Times article. It speaks about how liposuction is so harmful for the body for so many reasons, including a 1% mortality rate, the most highest level of risk for mortality and death than any other procedures for liposuction.
Well, you're
so
destroying.
We have that New York, right, destroying the fat cell, you're removing it.
Yeah, exactly. And that's what I say. So is that a fair trade? You go in, you destroy the cell. Yeah, that's great. But, and it doesn't have the ability to go back there. So it's going to take off somewhere else. And you know what? Here's the scary part. You don't know where it's going to come back. It comes back.
So a lot of these patients wind up with massive neck and massive legs.
Oh, that's what I just said. The neck,
areas.
the face. I'm going to give you an example. My mom had it done, okay? And she had it done on her stomach, and she looked great. Problem was, a year later, she looked like a linebacker for the 49ers. Came back all her arms, her neck. It was horrible. At least the stomach area, you could, cover it up with a loose shirt, whatever. But so
it's good to have this New York Times article. You print it out. You laminate it. She's shown. So So basically, what I'm hearing from you is you have the major light bulb that goes off in the patient's mind is, you know what? It's almost like you're validating their fears or concerns. Like, you know what? I have been doing all this. I have been suffering. I have been starving myself. I have done everything else on the planet. So you're validating that, and you're communicating that you understand that. And you're basically saying this is completely different. Is that a big light bulb that goes off in their brain?
Yeah. Let me tell you something. That's spot on. You got to validate their. You never want somebody to come in there feeling bad about. I look like shit because you probably think I don't eat right or I don't exercise, but in fact, I am doing all that right. So first of all, you want to validate, hey, listen, first of all, you're not experiencing anything that 99% of the people in your age category we all have. Everybody at different degrees. You make them feel good about themselves. We realize this is something. You're not eating any different. You're not doing anything any different. In fact, you're doing more than you ever did when you were younger, but you just can't get control of this. And I said, so let me take you to a theory that I have. So it's not by anything you're not doing or you are doing. You've done everything, and it's just not happening. And I get that because I was there. The good thing is what you can't get to, we can. And what you've tried and have not been successful with, we are. And people are your best form of advertisement, and I've seen over 2,000 patients. And this isn't something that we think works or we're pretty sure, we know it works. It's not what, people are your best form of advertisement because it's not what we say it does. It's what you say it did is what's more important. And then we are basically a referral clinic. So
You're planting that seed, so you're lending that confidence right away. We know what's going to happen. There's not even a question, because that's what patients, that's probably the number one thing. Is this going to work, right?
Absolutely. So you take, but there's another side to doing this, okay? And I don't care what kind of sales you're in. I don't care if you're selling popcorn, if you're selling lasers, if you're selling Girl Scout, it doesn't matter. If you don't create a sense of urgency, why today, why your product, and two, why your clinic, if you can't sell them on those three things and they walk out that door, you're not going to get them back. You've got to ink them right there. So if you don't create a sense of urgency, your close ratio will go less than half. Actually, that's being very conservative. So here's, again, why you, why the product, and why your clinic is what you got to tell them. And most importantly, why today? And let's not wait to think about it till tomorrow or next week, right? So there's two things that will close it. One is you've given them hope that they didn't have or the esteem before they walked through that door. Two is saying, I can give it to you at this price today. I take a testimonial group, before and after pictures. We are typically, and you can come up with whatever number that is, 2,000, but for 1,600 or 15, not only will I give you one area, I will give you two, and you be a testimonial, and you're going to get a pricing discount, and you benefit as the patient pricing point. We benefit because we get the before and after pictures. And if you'd like to do that, I've got, 2 or 3 spots left. Love to do that, but we must get you on the calendar today. We are booked out 3 weeks ahead of time. And you have to do these in consecutive order. So now they're like, shit, they're already booked out 3 weeks. I got to get on that calendar. And they said, well, what if I just try like 3 or 4 and then I want to continue? I said, here's the problem. You can try 3 or 4. We don't sell it per treatment unless we do Groupon or whatever. But to get, let's say you do your 4, and then you decide you want to continue. Well, if we're already 3 weeks booked out, and you have to wait, and you're not doing these treatments in consecutive and synchronized order, then it's basically starting over because you're going to have a 2 or 3 week downtime in between when you're supposed to be doing them to get the optimal results between a minimum of 2, not exceeding 3 times per week. And you're going to stop in the middle of that treatment, and what's going to happen is that fat is going to go back into the cell, and we have to start over with a process of breaking the fat down, eliminating it, and starting to shrink the cell. So you're really, if you're going to do it, go all in. If you want to say, I just want to see if it works in 2 or 3 treatments, one, you're not going to see a visual, and that's assuming that's why you're here, is you want to look different, not measure different. So here's the difference between trying it and doing it. If you want to try 3 or 4, great. But you're going to see a measurable, but you're not going to see the visual. That just doesn't happen till between that 6 and 12 treatment. And if you don't stay, and I can't reinforce it enough, in the consecutive order of doing it, then you just aren't going to, the results are completely different.
There's any disconnection of care. You cannot wait 2-3 weeks. It doesn't work like that way.
You can't.
Physiology works that you need consecutive treatment.
You have to start over. This is a cumulative. It is a minimum of 2, not exceeding 3. If you do it any other way, you're going to see a measurable slightly because we removed a little bit of the fat. It is not permanent, and that is not where the conscreen really is taking place at that point. So it's enough to show you it works 2 or 3 treatments because you're going down in 3 different measurements on your abdominal area, but you're not visually going to see it. That just doesn't come unless you do the consecutive, like you said, and you cannot have a week or 2 in between treatment. You can't do it that way. So it does create a sense of urgency. People will pull the trigger. People that have the money will do it.
So let me just play devil's advocate. So, okay, so I do the treatments. You're telling me it's not permanent. what's to stop it from coming back after I do my 12th treatment?
Okay, so here's what's stopping. One, you didn't just wake up one day and have that, and I don't use the word yet, I point to their stomach. You didn't just wake up one day and have that roll around your stomach area. Over time, over years, your cell has expanded. When you shrink that cell down, it doesn't just blow back up. Right now, everything's going to that area because it's enlarged. So when you shrink it down and you gain weight, it's evenly dispersed at that time because you're bringing your cell down in sync with the other cells in your body. You wonder why you don't have it in your arms, you don't have it in your legs, and you just have it in your stomach, because that cell's so expanded, it's the most porous opening where all the fat will continue to collect. So if you shrink that down, now anything, again, I'm going to go back to, is only as good as you maintain it with proper diet and exercise. But you would have to go out and gain an exorbitant amount of weight to blow that cell back up where it was before, and it took over time and years to get that way. It just doesn't work that way. It's an evenly distributed if you're gaining weight. I don't recommend this for people that are white-knuckling 30 to 40 pounds at all times and you're yo-yoing. This isn't for them. If you're maintaining, like I said, this is just, you're maintaining.
So basically your answer is it'll come back, yes, eventually. It's just like the liposuction. It takes time, but eventually, little by little, it will eventually come back.
Absolutely, yeah, absolutely.
So basically, that's how you get around somewhere, you're a Groupon kind of person. Well, I just wanted to do the freebie.
No. Oh, yeah. And I'll say, you know what? And we can do that. But what you're telling me what you want, because, here's what I want to do. I want to lose like 4 or 5. I've been to the gym. Nothing's worked. I've tried. I never had this before. And it just, every lady's got the same story after 45. Never had this before. Well, of course not. You collect cortisol fat through the subcutaneous fat through the middle section. As we get older, that's the area typically where it goes. So I get it. I've been there. We're close enough in age where we can have this talk, and they always like to hear that because, okay, at least you get it, and I'll tell them, you're telling me this is what you want, okay? And I'm telling, my job, I don't care what you do. If you're here just to do the 2, or you're here to do the 4, or you're here to do the 6 that you bought on Groupon, that's great. I'm happy to do that. But if you're telling me this is where you want to be, I want 4 inches, 5 inches, and I don't want it coming back, then this is what you got to do.
Right.
You got to be realistic. My job is to tell you realistically where you are at 6 and where you are at 12, okay? And I'm going to break it down for you. Here's where you are at 4, here's where you are at 6, and here's where you are at 12. Where do you want to be? And if you think any of one of those patients will sit there and say, well, I think I want to be at 4 where you don't see anything, until, nobody says that. Everybody says, well, obviously I want to be at 12 where there's multiple, inches at that point, and, we've shrunk the cell down. I don't want this coming back, and, yeah, so it's pretty cookie cutter.
So for those practitioners out there who I can just hear them thinking, they're thinking, no, don't tell me I got to do some kind of hard sell. Like, I don't like hard sell. What do you have to say to that? Like, you must do it at this time today.
Here's how you say that. First of all, I got scared. Never mind, the door got set on me. And what you'd say is you have to really honestly look these people in the eye that, listen, you're not doing me any favors by buying anything here from me today. My life doesn't change either way, whether you walk out the store buying or not buying, because the next person that walks through does want the help and does want the inches off and is willing to put the time and the work in, and they're going to get the savings. So it really doesn't matter.
Well, I'm just saying for the provider's mindset here, the practitioners here, for those of you who think, I don't like doing hard sell, that's hogwash. You got to get that out of your brain. It's not a hard sell.
That is not a hard sell. Your job is to inform them. If this is where you want to be, you need to tell me what it is you're looking for and where you want to be in this. If you're looking for multiple inches and you're looking for your cell shrinkage and for it not to come back, maintaining the proper diet and exercise, then you need every bit of 12. If this is something I always say this, and it lends you credibility. This is where you everybody's skeptical. Get that through your head when they walk through the door. Every one of them.
Mm-hmm.
So you got to break in the first 10 minutes, 5 minutes, that trust barrier. And how you do that, how you break that wall down, where now you've got their trust, and then anything you say past that, they're listening. So what you say is, if you've tried everything, I suggest, I don't recommend this for anybody that's not tried diet, exercise, and you've exhausted every other avenue before doing something like this. And it's got to bother you enough to warrant spending the money. If it doesn't, then forget about it. I think you look great, but you're your own worst critic. And if it's a small price to pay, if it really bothers you, you got steam issues over it, or you're just self-conscious, or you're in a bathing suit, or it's the difference the way your clothes fit. My favorite line is, I didn't do this to get into a bikini anytime soon. That ship has sailed. 2 kids later, 49. I did it to look and feel better in my clothes. And every woman will agree with that. Yep, you're absolutely right. And that's why I want to do it. I just want to, there's certain things I can't wear. There's certain, and so you identify with them on a level, right? And they get it. And then I'll say, it's the best gift you'll ever give yourself. If you've got the funds to do it, but listen, family first, bills first, that all comes first. It's priority. If you have the extra, trust me, it's the best thing, honestly, the best gift you'll ever give to yourself, because as we're getting older, nobody likes getting older, but if there's something little that you can do, and I always say, and any doctor would tell you this, anytime you can get something in the beginning, way less money, way better results. If you let it get away from you, like half of the women that I see every day, where it started out, they had 3 or 4 inches, and then that went to 6 to 10, then it's a lot more money and not as good a result. So if you just do this as preventative from furthering, that area to expand and getting inches down, and the earlier you get it, the better you are with anything. And everybody will, and you always have them, and you ask them the question, would you agree? And you have them check yes. They agree with you on everything that you put out there.
You have a checklist of everything that you're speaking. They're agreeing.
You'll ask them, don't you agree that yes, I do. Wouldn't you agree that if you were going to do it, and this is where you wanted to be, and would you agree that it's worth, well, one, pricing point, you're going to save yourself $700, and 2, you're going to get the results of why you're in here. It's kind of, because they'll say, well, why do you sell a Groupon for $150 for 6, and I'm not going to get skinny, I'm not going to get multiple inches. I says, well, let's be realistic. You can't even get Botox for $150. Where is it that you can think that you could get some type of gimmick where you could get skinny, off of $150? Doesn't work that way. It's to educate people on technology, to show you that you don't have to be cut open to look good anymore. Technology is really far advanced now. So it's to educate people on that. And more than that, we give you 3 or 4. It's enough to show you it works. Again, you're going to get a measurable difference. It's enough to show you it works. But if you're telling me, well, I don't want it just a little measurable, I want to be able to get back, into those jeans and have it with, through the waist where I could, well, then it's every bit of 12. And here's how we're going to get there. Bottom line.
In your clinical experience, you're finding that the biggest, it's compounding on itself, and the real benefit is on more of the back end.
Absolutely. Mm-hmm.
Like a buddy of mine was telling me, his wife is very conscious. She eats well. She exercises all the time. It wasn't until her 6th lipo section. She had this one area on her belly, just wouldn't, was very resistant. She's about 50. Just wouldn't go away. And boom, 6 sessions. After the 6th session, boom, she was ecstatic, thrilled.
Yep. And I will tell every patient, 1 through 4, you're going to say, what the hell have I done? This thing is not working, okay? I don't see a damn thing. I said it's not until that 6 to 12 treatment where visually then you start to see the contouring.
All right. You've been beautiful, wonderful. Let me just ask you, just in terms of just you can wrap it up with this because it's getting late for everybody.
Yep.
How would you arm your patients to be referrers to you? What kind of tools or tidbits or strategies or scripting can you offer?
For referral?
Yes.
You really almost don't even need to. You give them a couple free body wraps or a couple free treatments for referral. But I really haven't had, you certainly want to take care of your patients. But, a gift certificate, any little thing like that is appreciated.
Acknowledge them. The point is to acknowledge them.
Absolutely.
And to arm them.
Yep.
And to arm them.
Yep.
You ask your patients for referrals. Is that a strategy you use? Do you consciously seek to increase
in the beginning, you certainly wouldn't. You'd wait till Betty has had our 6th treatment and lost 4 inches and say, hey, I'll tell you what, if you can get somebody in here, I'm going to give you a couple body wraps and an extra couple treatments, or maybe we'll even do another area. And I'll do even better than that. I'll give whoever you bring in the deal I gave you. If it's a family member or it's, we get a lot of referrals.
Let me just ask you this. In terms of, obviously, we all know that these same patients, they're continuing to get older and older and older and older. So these patients are going to be coming back year after year after year. So how do you say, well, this is permanent? How do you transition to like a VIP or a frequent flyer, or are they coming back on a regular basis? How do you do that?
What do you mean on a regular basis?
In other words, a yearly basis where you recapture the patient next year.
They're going to offer different. I don't know. I don't see. I guess I'm just doing too much new business. I don't need the old business, and I really.
That's pretty good.
I don't know.
So I've done worked with a lot of consultants already, and they say that this business, the aesthetic business, everyone's getting older. So when you take good care of these patients, they're going to come back to you, one fashion or another. And if you don't, somebody else will, because they're getting older. They're going to take care of themselves.
Yeah, they're going to. You're right, Mike. You're right. But here's the thing: they're going to come back for that second area or whatever. But if you tell them, oh, this is a maintenance kind of thing, and come back and see, they're going to say, wait a minute. So you're going to charge me $1,500 for 12, and you're telling me I got to come back?
No, they don't want to hear that up front.
No, that's my point. So I don't say, well, we'll probably see you next year. What I say is, if you have another area, I'm going to discount it. And if you come back, let's say you have, you know what I mean? And I spin it that way. Yeah.
Right. All right, my dear. I really want to thank you, and we appreciate you. I know you're an absolute rock star. You're a rock star.
Oh. So are you, Mike. So are you.
Thank you, everyone. We appreciate your presence, and we look forward to having a special training, actually, this coming up Tuesday, where the doctor makes over $100,000 a month. Okay? So don't miss that.
Okay.
And thank you, everyone. We'll see you Tuesday at 1 o'clock
Dawn.
Eastern Time.